Hi, this is Steve Platek with Evolution, This View of Life, the magazine that approaches anything and everything from an evolutionary perspective. We're back here again with Professor Gordon Gallup from the State University of New York Department at Albany Department of Psychology. And today, Gordon and I are going to talk about a paper, a topic for which we co-authored a paper with Rebecca Birch on semen as an antidepressant. Gordon, you've continued in this line of research while I've moved on to doing things with neuroscience. Can you give us an update on semen as an antidepressant?
Yeah, let me just kind of bring you up to speed a little bit about semen in general, and then we can talk about semen as an antidepressant.
Sounds good.
It turns out that semen consists of both sperm and seminal fluid. And if you extract the sperm from semen, you're left with what's called seminal plasma. And seminal plasma is a mixture of all kinds of sex hormones and neurotransmitters and endorphins and placental hormones and immunosuppressants, among other things. And when we first got interested in semen, we discovered by going through the semen literature that within an hour or two after having been inseminated, you can detect elevated levels of seminal chemicals in a female's bloodstream. So some of seminal plasma apparently passes through vaginal epithelial tissue and gets into the woman's bloodstream. And once it's in the woman's bloodstream, it can have profound and obviously far-reaching effects. And we discovered an article in an esoteric medical journal written by a psychiatrist who was seeing a woman patient for depression. And in the course of treating her, she became romantically involved with a man and experienced spontaneous remission of symptoms in terms of her depression. And the psychiatrist that was seeing her wrote a theoretical article for an obscure medical journal in which he speculated that semen might have antidepressant properties. And we were talking about this in a lab meeting, and it occurred to me that one way to examine this empirically would be to distinguish between sexually active women that were having unprotected sex from sexually active women that were using condoms. So we developed a survey that we administered to a large sample of co-eds here at the University at Albany when you were a graduate student. And we also administered the Beck Depression Inventory to these co-eds, which is a brief 20-item multiple choice test that is the method of choice among practicing clinicians for making assessments of depression. And we partitioned these females into three groups. Those that were sexually active, and then subdivided those into those that were being exposed to semen on a regular basis, i.e. were having unprotected sex, and those that were using condoms. The third group consisted of females that weren't sexually active. And what we discovered was that scores on the Beck Depression Inventory varied as a function of semen exposure.
Right.
They didn't vary as a function of whether females were sexually active or not.
Right.
Females that were having unprotected sex were significantly less depressed than females that were using condoms. Females that were using condoms, however, were neither more or less depressed than females that weren't having sex at all. So it's not a question of whether you were having sex. It appeared to be a question of whether or not you were exposed to semen. And this then raised all kinds of questions about other possible inherent confounds between females that might be having unprotected sex and females that were using condoms, so that you might expect females that were having unprotected sex to be more likely to use birth control pills. You might expect females that were having unprotected sex to be more likely to be involved in a committed relationship, more likely to be involved in a long-term relationship, etc., etc. So we attempted to to look at the data and partition out these kinds of confounds, and discovered that the presence or absence of birth control pills made no difference. And the same thing was true for whether or not they were in a committed relationship. That made no difference. And when we looked at those that were in committed relationships as a function of how long they'd been in a committed relationship, that didn't make a difference either. So it seemed to suggest that semen might have antidepressant properties. A lot of people, however, continue to try to argue that maybe there are some kind of fundamental inherent differences between females that have unprotected sex and females that use condoms. And one way of separating out that and controlling for that argument is to try to distinguish between these females in terms of whether it represents an underlying difference in a trait or a transient chemical difference that's induced by semen. And if you'll recall, it turns out that females that were being exposed to semen on a regular basis, if you look at how long it's been since their last sexual encounter, as the time since their last insemination increases, there's a corresponding increase in their scores on the Beck Depression Inventory. Females that are using condoms, however, scores in the Beck Depression Inventory don't vary as a function of how long it's been since they had sex. So that suggests that rather than being an inherent difference, it's a chemically induced difference due to semen exposure. Now, since that report was published, Becky Birch at SUNY at Oswego for her dissertation, while you were still here, replicated that original study and extended it to a sample of about 1,000 females and found the same effects, and then looked at a number of other things as well. And one of the things she looked at was what happens in the case of females that are in committed relationships if the relationship terminates. In other words, if they experience a breakup. And what she found was that females that were in committed relationships that were having unprotected sex were much more adversely affected when the relationship terminated than females that were in a committed relationship and were using condoms. Moreover, the presence or absence of condom use predicted the likelihood that these females would experience a sexual rebound effect. Those that are in committed relationships that terminated and had been engaged in unprotected sex began having sex with another male within a matter of weeks after the relationship terminated. But those that were using condoms in their former relationship didn't begin to have sex with other males for a period of months after the termination of the relationship. So it suggests that there may be a semen withdrawal effect. And that's one interpretation of the fact, if you remember, that another dimension that seemed to distinguish between women having unprotected sex from those that were using condoms is that those that were having unprotected sex had sex much more often than those that were using condoms. And one interpretation of that is that the reason they're having sex more often is that, in effect, they're self-medicating. They've discovered that sex, they don't realize it's semen, obviously, but they've discovered that sex is a means of modulating their mood. And that's what prompts an increase in the frequency of sex on the part of females that are being exposed to semen.
Now, exactly. It suggests that females might be self-medicating and some unknowingly self-medicating. Is there a correlation between being exposed to semen and either increases or decreases in promiscuity or extrapair copulations? I mean, it seems to me that, like, as a corollary, okay, if I like to drink alcohol, right,
Yep.
I might have a drink of choice, might be a glass of wine, but I'm happy to chug back a beer or a shot of bourbon or a margarita. And so in some kind of seminal absence, that is maybe your pair bonded mate is at an academic conference or away on business or otherwise just has the proverbial headache. Um, are these women more inclined to pursue self medication through extra pair copulations?
That's a great question. I mean, I don't think there are any systematic data that have been collected on that, but it would certainly follow from the work that we did that shows that semen has psychoactive properties. That's
Mm-hmm.
for sure. There's also evidence from homosexual males that engage in unprotected anal sex, where they often attempt to retain their partner's semen for an extended period of time afterwards, and they attempt to do this through the use of butt plugs or by lying on their back and holding their feet in the air. And the fact that they attempt to retain semen for extended periods of time suggests that semen has positive psychological effects.
Now, in this homosexual study or anecdotes,
Those are anecdotes.
those are
Yeah.
anecdotes. Okay, so what is the reason that the homosexual men give for that? Because certainly they're not. I presume they're not privy to the research on semen as an antidepressant. They're not
Correct.
saying I want to medicate. It's not like they're shooting up a drug. So what are the self-report? I mean, why? So certainly, I agree with you. I think it may be a psychoactive, neurochemical effect that's driving this behavior unknowingly.
Right.
What do they report?
I don't know.
Oh, okay.
Nobody has
Nobody's asked.
posed that kind of question to them.
Surprise, surprise. The
We
politically
tried
correct
we
world.
tried to do a study with homosexual males in an attempt to partition those that were having unprotected anal sex into one sample and those that were having protected anal sex into another sample, so that which would be an analog to the female study. But what we discovered is that all of the homosexual males, whether they were having protected or unprotected anal sex, were engaged in unprotected oral sex.
How about that?
So there's a huge oral sex confound.
Huh.
All of the homosexual males that we sampled were routinely engaging in unprotected oral sex, which interestingly enough, makes sex for homosexuals unprotected.
Right.
Because if your partner is carrying the AIDS virus and you engage in oral sex with your partner, if you've got a cold sore or if you've got an abscess on your gum or if you just bit your tongue, there's a site of entry for the AIDS virus. So you can use condoms until you're blue in the face when you have anal sex, but if you're having unprotected oral sex, you're at risk.
Sure. And
No question.
yeah, no, certainly. And so are the effects modulated by oral sex? I mean, for example, I know that in traditional pharmacology, medications that are taken orally go through. I mean, the dosages have to be much greater because of the digest. I mean, hydrochloric acid in the stomach destroys just about everything. So I reckon anally and vaginally, the absorption coefficient is much greater than orally. But is there an effect for oral ingestion on the depressive properties or anti-anxiolytic effects of semen?
Nobody knows.
Ah, damn.
Nobody's examined that. But let me run a little bit with the oral sex kind of question.
Okay.
Because you can if you think of semen as a drug, then you can begin to examine some of the parameters of things like drug dosage and things like route of administration.
Mm-hmm.
And
Right.
the route of administration when it comes to many drugs involves things like
Injection.
intravenous,
Yeah.
subcutaneous, intramuscular, et cetera, et cetera.
Right.
With semen, it can be administered vaginally, it can be administered anally, it can be administered orally, and it could even be administered topically.
Right.
So it would be interesting to do a really comprehensive study in which you compare the effects of semen exposure, i.e., through vaginal insemination, anal insemination, oral ingestion, and the topical application of semen to see if you can distinguish between the differences in the magnitude of temporary antidepressant effects.
Mm-hmm.
Now, we ran across one study recently that showed that women that were routinely ingesting their partner's semen had a significantly lower risk of developing preeclampsia if they got pregnant. And preeclampsia is a birthing complication that usually eventuates in spontaneous abortion. And women that routinely ingest their partner's semen have a significantly lower likelihood of developing preeclampsia, which suggests that some of the properties of semen are surviving the ingestion digestion process and are exerting a significant effect on the integrity of the fetus later on.
So would it be safe to say, I mean, and perhaps inappropriate to say, that women who engage in oral sex with their partner are since receiving an oral vaccination?
Precisely. That's precisely the case. But and let's come back to that.
That's mind-blowing.
Let me just follow up on the idea that the fate of chemicals that are ingested may be fundamentally different than the fate of chemicals that are applied vaginally or anally. As you well know, birth control pills, the steroids contained in birth control pills survive the ingestion and digestion process quite nicely.
Yes.
So while I agree that the different routes may entail, different side effects, there's pretty good evidence that what's ingested orally, it often bypasses the ingestion and digestion process by way of getting into the individual's system and producing potentially profound effects.
See,
now I understand that testosterone doesn't survive the digestion process.
Right.
But, maybe a lot of the other hormones in seminal plasma do survive the digestion process.
So this brings me to one of the things that when I talk about this, I always get the question. So on the whiteboard in class, I list the chemicals that are in semen, and the students are astounded by some of them. Has there been any advance in the science towards identifying? I mean, here's the thing, right? In psychology and in science in general, when we have that many factors in a concoction, the goal would be to try and isolate the few or the single component that is driving the effect, right? And so has there been any kind of science trying to find out? So perhaps it's not testosterone because of the digestion issue, estrogen, progesterone. There's a number of prostaglandins, neurotransmitters, neuromodulators in semen. Where are we with respect to understanding which of those chemicals or what combination of those chemicals is driving this psychological effect?
That's an excellent question, but it's not a question that anybody has pursued in a systematic way. But ultimately, you ought to be able to identify what it is that's in semen that is producing the antidepressant effects. And if you could do that, then maybe you could develop simulated semen pills, suppositories, for heaven's sake, that could be used to modulate mood in a much more natural way than using, antidepressants that have negative side effects, et cetera, et cetera.
I have just a couple more questions.
Absolutely.
Gosh, this is fascinating. With respect to other aspects, let's talk about female behavior first, and then I have a question about male behavior. With respect to female variability across the menstrual cycle, things like premenstrual tension, distress, or syndrome, and uncomfortable periods versus comfortable periods, and generally just changes across the menstrual cycle. Is semen a medication, a treatment for any of those kinds of conditions, or could it be?
The evidence suggests, and it's only suggestive, but the evidence suggests that in fact it may antagonize PNS symptoms.
Okay.
Yeah, you can think about menstruation as a period of semen withdrawal, in
Right.
much the same way that a breakup might represent a period of semen withdrawal for females that are having unprotected sex. And it's because many people, for various reasons, refrain from having sex during menstruation. And therefore, menstruation may produce because of regular menstrual cycles, females may become temporally conditioned to these pending periods of semen withdrawal. And if you look at variation in female sexual appetite on the part of females that are naturally cycling, there's a postmenstrual peak, an ovulatory peak, and a premenstrual peak.
Oh, God.
And the premenstrual peak may represent anticipatory semen withdrawal. The postmenstrual peak may represent
Recovery from withdrawal.
recovery from withdrawal. So it fits that very well. It also fits the increased risk in depression that many females experience during the postpartum period. Postpartum depression can be very serious. And the postpartum period, just like menstruation, is a period of semen withdrawal. Most doctors recommend that females abstain from sex for 6 to 8 weeks after childbirth. And that makes the postpartum period a period of semen withdrawal. The same thing applies to menopausal depression. After menopause, the incidence of sexual behavior on the part of some females may drop precipitously because they lose the elasticity in the vagina and intercourse becomes painful, etc., etc. So postmenopausal females may experience semen withdrawal. So it leads to a very rich and potentially testable set of hypotheses that could be used to triangulate and integrate a lot of seemingly diverse reasons for depression in females.
Now, that makes total sense to me, right? And we've talked about that previously. But you mentioned something that queued me up here, and I took a note on contextual effects. My understanding of learning effects in drugs is that in addition to learning that a drug is rewarding, even if it's implicit reward, such as the way we're talking about semen not having unknowing effects on psychology, there can also be contextual effects. And the way these studies are typically done is you take a rat and you put him in half of a cage that's painted black, and you inject him with something. And if you continually do that, then he associates the black side of the room with being injected, and he experiences a reward or a withdrawal symptom.
Right.
And so is it possible that women could develop contextual associations? So just going to throw this out here. Let's say that a woman or a group of women tend to be inseminated most frequently in the bedroom. Is it then the case that when they enter the bedroom, they might experience a conditioned association that drives subsequent behaviors?
Isn't that interesting? Yeah, I'd never thought of that, but I mean, it seems to follow. I mean, it seems to be consistent with what's known about other drug effects, and it may generalize to things like body odor.
Yeah.
So her mate's body odor represents a conditioned stimulus that antagonizes perhaps feelings of depression, etc., etc. So that following periods of separation, it may not only be a case of semen withdrawal, but it may also be a case of the absence of condition cues that might otherwise substitute
And
for
particularly odor
semen.
cues are very strong cues.
Exactly,
Yeah.
particularly when it comes to sex.
Yeah.
Yes,
Yeah. I mean, so one of the
absolutely.
worst things that you could do is repaint your bedroom, right?
Perhaps.
Let me ask you just one last question because we've been at it here for a while.
No,
And,
no, that's
and
all
we're,
right.
we're
We can
going to
go
go
on
to the
for.
other side of the bedroom here. We're going to talk about the men. What is the current understanding of semen variability among men? I mean, I would put my degree on the line to suggest that not all men's seminal ejaculate is created equal. What are the factors that would make some men, quote unquote, more addictive versus some men not having those characteristics in their semen?
Well, I mean, there's a lot of very good evidence, and Jen Davis and I have summarized this evidence that each man has what amounts to a semen signature, that there are distinctive chemical differences that distinguish one man's seminal fluid from another man's seminal fluid. And some of the most compelling evidence in support of that notion is that a change in paternity for a multiparous female is a risk factor for preeclampsia. So the change in seminal chemistry, which also is correlated with the change in paternity,
Right.
now produces a rather dramatic increase in the risk of preeclampsia. And that's prima facie evidence for the fact that each male has semen that's chemically different from other males. And it suggests the possibility, I'm going to talk about this spring at the NEPS convention, that semen sampling may be an embedded dimension, evolutionarily speaking, of courtship among females. So unwittingly, during the courtship phase, females are sampling semen from different males. And depending upon the likelihood that it's a good match or it's a genetically compatible match, the side effects of being inseminated by one male may be fundamentally different from the side effects of the other. So in other words, you either wake up the next morning with regret for what you did the night before, or you wake up the next morning head over heels in love.
Yeah.
And there's a very nice parallel to that. Susan Hughes and Marissa Harrison and I did a study a couple years ago on kissing, in which we had over 1,000 undergraduates fill out detailed questionnaires about their kissing experiences and their kissing preferences and so on and so forth. And one of the things we discovered was that the majority of both male and female undergraduates have had the experience on one or more occasions of finding themselves attracted to someone only to discover after they kiss them for the first time that they're no longer interested. So the first kiss can be a make or break proposition. And if you think about a kiss, at the moment of a kiss, there's an incredibly complex exchange of information in terms of tactile cues and postural adjustments and olfactory cues and the exchange of saliva and all kinds of things. And that may impinge on hardwired mechanisms that process this information in such a way as to make an assessment of the health, the vitality, the reproductive status, and the genetic compatibility of the other person as a prospective mate. And functions now to promote more informed, albeit subconscious, mate choices.
Certainly.
And I would bet you my PhD that the same thing is true for semen sampling.
Yep.
That sampling the semen from different males may provide information unwittingly that has an important bearing on the future status, particularly the reproductive status of that relationship. And as you know, that prompted one of my former students, who I'm looking at over the webcam right now, to characterize the courtship as being the equivalent of sampling a semen buffet.
Yeah, no, and it raises a number of really interesting questions for me because the area that I'm really interested in that relates to this is infidelity and detection of infidelity and mate choices. And so, is it reasonable to suggest that if your partner experiences preeclampsia or phenotypic cues to preeclampsia, that might be an indicator of infidelity?
It could. Yes, it could. Yes, it certainly could, because a change in paternity is a risk factor
Right.
for preeclampsia. So if you're in a committed relationship with a female who's had multiple children that have all been sired by you, if now a subsequent child develops preeclampsia, there is a distinct possibility that that might be indicative. It's not ironclad, obviously.
No,
The
no, no,
correlation
of
is not
course not.
perfect, but the correlation certainly would be greater than zero
Yeah.
in terms of the likelihood that there may have been a change in paternity. We think the same thing may apply to morning sickness.
Yeah.
And that's the other thing I'm going to talk about at the NEEPS convention in the spring. That morning sickness, among other things, may represent the lack of a maternal tolerance for the unique chemistry of the fetus that's due to the presence of the father's genes. And therefore, seminal priming, that is high frequency insemination by the same male prior to conception, may then generalize that the female. Well, what seminal priming will do is produce seminal tolerance,
Mm.
tolerance to the semen chemistry
To
of
the
that particular
non-self
male, which may
genetics.
then generalize to the chemistry of the fetus and reduce the severity of morning sickness symptoms. And one of the clear predictions would be that for a female who's multiparous, if she experiences, one of the simplest prediction would be that the more children she has that are sired by the same male, the less her morning sickness symptoms, the less severe should her morning symptoms should become less severe over successive pregnancies. But if she experiences sudden resurgence of morning sickness in response to the birth of a child, that might be evidence for a change in paternity.
Mm, mm, mm. And the other thing is, yeah, clear prediction is, I mean, to test that hypothesis, you'd expect that women who use barrier contraceptive condoms up until the point of, hey, we're going to try and have a baby, ought to experience greater magnitude of morning sickness.
Precisely. And the same thing's true for preeclampsia.
Sure, absolutely.
That's been demonstrated. In fact, the greatest risk factor for preeclampsia, and I predict the same thing would hold for morning sickness, is conception that occurs as a consequence of artificial insemination.
Hmm.
Conception that occurs as a consequence of artificial insemination involves conception as a byproduct of unfamiliar semen.
Mm-hmm.
You
So,
can't get
so
much. The only thing the only real world condition that approximates artificial insemination is rape.
right.
And you would predict that the incidence of preeclampsia would be higher as a result of rape, and the same thing would be true of morning sickness.
Yeah,
Absolutely.
yeah, and both would be adaptive consequences of having no choice in the mating arena, right? I mean, preeclampsia typically ends in spontaneous abortion. If you're inseminated and fertilized as a consequence of forced copulation, that would be one of the best things that could happen to you.
Absolutely. We think a lot of instances of spontaneous abortion may, in fact, be a blessing in disguise.
Yeah.
That spontaneous abortion may be an adaptive mechanism that evolved to terminate pregnancies that are not in females' reproductive best interests. And a pregnancy that occurs as a consequence of rape would be a prima facie case, because the likelihood that that male is going to stick around and protect and provision the female and her infant are practically zero.
Mm. Outstanding. Well, Gordon, thanks again for your time. My gosh, it's been so much fun.
Steve, it's always my pleasure. Having conversations with you is always very stimulating and exciting.
Well, on the heels of that, I really appreciate your time. Once the link is up, I'll let you know.
Okay, Steve. Sounds good. Talk to you later.